Greetings from sunny but extremely sad Istanbul. This is Atilla Yeşilada broadcasting for Real Turkey channel. This is going to be a brief video. I want to address a major problem in the global coverage of Turkish events. Everybody is focused about the dispute in Eastern Mediterranean, mainly between Turkey and Greece about continental shelf and exclusive economic zone rights, but actually a much broader game that involves Arab countries, France, EU, etc., etc. I don't deny the importance of this dispute, but I want to explain to my foreign audience that Turkey and Greece have been playing this game of one-upmanship since 1974, when Turkish forces liberated the Turkish minority on the island of Cyprus. Since then, we have seen dogfights, warships rubbing against each other, gunshots to prevent violation of borders, etc., etc. So the likelihood of a naval engagement or total military engagement between Turkey and Greece are, in my view, nil. Also, I want to, for ethical reasons, want to make my position clear. For those of you who watched my previous videos, I think you would agree with me that I am not an advocate of the views or policies of the Erdogan government. In fact, most of those videos involve one kind of or other type of critique about that government's performance. But in terms of East Med, Turkey is right. If the world accepts the thesis put forward by Greece, Turkey, a nation of 80 million people, will not be able to access the Aegean Sea or Eastern Mediterranean. Not only will we use our navigation and civic flight rights, but we will also be completely shut out of whatever hydrocarbon resources are lying at the bottom of the East Med. This I consider extremely unfair, but this is not the objective of this video. What really bothers me is that nobody is talking about Turkey's health crises. And that, to me, is an issue that is at least 10 times more important than what might or might not happen in Eastern Med. Let me lay out the context here for you. According to the official tally by the Ministry of Health, Turkey has 1,702 new corona patients yesterday, with roughly 60 of our citizens dying of this nasty disease. Unfortunately, this number is found neither credible by the public nor by the medical profession. The August poll by international surveying agency Metropole finds that confidence in our health minister, Mr. Fahrettin Koca, has declined from the peak of 60 some percentage in April to 35% or so in August. When people lose confidence in their governments, they spend less, they take the law into their hands. In this case, well, they'll lock themselves at home, and that would be an economic damage. I just watched one of the leading infectious diseases experts on TV. He claims actual cases are at least 10 times as high as the official case. That would roughly amount to 17,000 new patients a day. And that's right, United States, I think yesterday reported about 30,000. Turkey's number would be the highest in Europe, and would be third or fourth after India, Brazil, and United States. I don't remember the exact ranking. I have also read other forecasts by Polymetra, for instance, which says that in the month of September, Turkey will have 45 to 48,000 new corona patients. Now, Turkey has at most 40,000 ICU units. I have watched scenes in Central America where people died on the streets. I watched desperation of the healthcare system in Brazil. Similar events may transpire in Turkey. Turkey's health professionals are overworked, underpaid, and extremely tired. Infections and deaths among even pharmacists, nurses, healthcare providers, and of course, physicians are rising exponentially. So far, the Turkish health system performed miraculously well in terms of slowing the spread of the virus, but unfortunately, a large majority of the people simply don't abide by social distancing and public health measures. To some extent, the fault lies with the government, which has hidden the actual number of cases, thus underestimating or leading people into a false complacency that the virus is not a big problem. When they find out, there will be a political earthquake in Turkey, and we might have political instability. But that too is not my main concern. I want to talk about the economic impact of such a scenario. I just broadcast a video titled Turkey's Winter of Stagflation, and one of the reasons I cited was the raging outbreak. Today's numbers show to me that I was right. I wasn't speculating. Even in the official tally, Turkey may easily see 5,000, 6,000 cases a day, say in October. Already, the government, even though it denies lying, has started taking increasingly drastic measures to slow down the spread of the virus. Turkish colleges, and with the exception of first grade Turkish secondary schools, will not be opened this fall. Mostly, we would have remote education. Today, Turkey mandated wearing of masks in 81 provinces without exception in all public places. The government health inspectors are raiding restaurants, bars, clubs, beaches, etc., to make sure social safety distances are not violated. But this is not going to be enough. We know from the experience of other countries, when the virus is so widely spread within the population, you have to have shelter at home regulations, or at least citywide quarantines. I anticipate that Turkey's restaurants and cafes and movie houses and theaters, as well as shopping centers, will be closed within a month or two. To recall, Turkey is a small business heaven. In particular, in services, Turkey is dominated by millions of ma and pa stores or entrepreneurs who use their own meager capital to make a living in their small stores. These people have already suffered a lot, with Turkish economy contracting by 10% in the second quarter of the year, hoping that in the summer business will get better and they will make up their losses, pay back their loans, and perhaps even rehire the employees they have fired. None of these will happen. Turkish economic activity rolled over in August, and it's going to get worse as virus, currency shortage, and of course, exports to EU and tourism decline because of seasonal reasons. Turkey's broad unemployment rate is 25%. One-fourth of the workforce is either furloughed or has voluntarily withdrawn from the workforce because there is no hope of finding jobs. You really can't have an economic recovery in a country where one-fourth of the households are unable to consume. Worst, the Turkish government has run out of fiscal and monetary means to stimulate the economy. Turkish budget deficits, excluding transfers from the central bank, are roughly 4.5% of the national income, which sounds very low compared to other countries. But you have to remember, because of very high interest rates, Turkey can't borrow abroad, and Turkey's financial system is too small. That means if the government borrows more, private sector will have to borrow less. Money printing, so far, which has been rampant, has led to a loan boom, which has spilled over to imports, with current account deficits rising each day, for which we don't have the financing. Some of it spilled directly into the hard currency market. People buying hard currencies, sometimes keeping it in the financial system, sometimes putting it on their mattresses just in case. As a result, Turkish lira is one of the worst performing currencies against the dollar amongst emerging market nations this year. Now imagine, this is summer, how bad it can get in the winter months when COVID-19 mingles with seasonal, traditional upper respiratory diseases like, flus and a sundry of viruses. People will stay home whether the government orders it or not. They will not visit shopping centers. They will not go to movies. They will not go shopping in the small mom-and-pop shops that I have just described. We're talking about a massive economic crisis which the government cannot cure by spending more money, either directly through the central bank or via the budget. It is extremely scary, and it startles me that even people who are Turkey experts or invest in Turkey or have factories in Turkey don't seem to understand or acknowledge this problem. Turkey is very close to a health disaster, which will rapidly spill over to politics and Turkish economy. I just wanted to warn everyone to be careful, whether they are expats living in Turkey or whether they are people doing business with Turkey or planning to visit Turkey. This is the time of extreme caution. Thank you very much. This was by far the most unpleasant broadcast I have shot, and unfortunately this is Atilla Yeşilada broadcasting for real Turkey. Stay healthy, stay well.